Hey, Court,
Hmm.
Dr. Michael Leiter just entered the waiting room. What is our
Uh,
life right now?
yeah, exploding head emoji.
It's about to be a wild ride, Joel.
And yet somehow I feel like it's going to be like not a wild ride.
It's going to be the chillest conversation of all
It's going to
time.
be the best ride.
This is going to be great. Okay. Are you ready? Are
Yes.
you ready? Okay. Let's go. Welcome to season 2 of the Burnout Room, a podcast about burnout, effective leadership, and well being in nonprofits.
I'm Dr. Courtney Keim, a workplace wellness researcher and a professor.
And I'm Sarah Burress, an organizational leader and nonprofit wellness advocate.
Whether you're facing burnout, leading a team, or working to build a healthier workplace, this is your space to find support, community, and solutions for any organization.
Courtney, before we get into today's episode, I want to talk about how lucky we are to be partnering with some amazing organizations this season, including today's presenting sponsor, Talent Metrics.
Yes, here are a few words from the founders of Talent Metrics, fellow IO psychologists, Cy and Mike.
Hi, I'm Dr. Mike Chetta, Managing Partner at Talent Metrics Consulting.
And I'm Dr. Sai Islam, Vice President of Consulting at Talent Metrics. We are proud to sponsor the Burnout Room podcast.
Talent Metrics is a boutique human capital consulting firm where we use science and data to improve the workplace.
We focus on quantifying the return on investment of human capital projects, which may include surveys, assessment development, training, work redesign, and other science and data-based interventions and employee-facing initiatives.
We help our clients to understand what they're doing well, where they can improve, and how to determine the impact of their programs and strategies on employees and leaders.
If you're listening to this podcast and have questions about how Talent Metrics can help your organization with recruitment, hiring, employee engagement, training, or even organizational development, just reach out to us for a free quote at talentmetrics.io or find Mike and myself on LinkedIn.
Remember, your organization's people processes can be refined and improved, and Talent Metrics can help.
On today's episode, we are honored to talk to Dr. Michael Leiter, an internationally recognized academic, researcher, and organizational consultant who is a leading authority on workplace psychology, renowned for his pioneering work on burnout and organizational civility. Co-author with Dr. Christina Maslach of the Maslach Burnout Inventory and the Areas of Worklife Scale, Dr. Leiter has spent decades developing assessments that define modern occupational health, such as SCORE, Strengthening a Culture of Respect and Engagement, which is a proven framework for cultivating workplace civility. Dr. Leiter is based in Nova Scotia and Australia, where he consults globally across high-stakes industries, including healthcare and management. And through his books, articles, and workshops, he provides leaders and frontline workers alike with the blueprints needed to dismantle the exhausting favor economy, build protective local infrastructure, and reclaim professional efficacy.
Dr. Michael Leiter, welcome to the Burnout Room.
Oh, well, it's good to be here, and it's good to see you. Yeah.
Yes, thank you so much for being here. We are absolutely thrilled to be talking to you. I think Sarah had mentioned to me that everybody in her family knows that we are talking to you today.
Yes.
I bragged to my ophthalmologist at my eye doctor appointment today that I was talking to you. So,
Yes. The people in our lives know what a big deal this is for us. So we just
This is a
certainly
big deal. Oh, okay. Oh,
deal.
well, it's a big deal in my life to talk to you. So that's fantastic.
Yeah. Well, thank you. I think the reason why it's such a big deal to us is because, normally when we talk to people who are on the podcast, the first thing that we ask them is how they would define burnout, because burnout is a term that gets thrown around and some people think about it differently maybe than others. And so we always ask that of our guests, but it feels a little weird to ask you that because you literally came up with the definition of burnout. You've written books about burnout. We know that you think about burnout as not an individual failing, but as a relational crisis between people and their work environments. I guess my first question for you is since you are the foremost expert on burnout, how did you actually get into this research? What was it about this topic that drew you to it?
Well, what drew me to it was seeing that it was an issue that was important to people. I could see people were struggling with that. You know, I was doing some work with some residential mental health center back when I very first started getting involved with this. And I could see that there were people who were, you know, very dedicated to their profession, but were quite willing and to contemplate leaving that profession because of the strains that they were experiencing in the course of doing their work. And I was struck also that it wasn't so much the strains of working with the patients that were the issue, but the strains of working with different aspects of the organization that were actually more the, you know, impetus for their kinds of actions of leaving that world. So it was important. It was really happening to people. It was work related, and it was had to do with relationships among people, and that's where, you know, I was staying with that idea of it being a problem in relationships with your work as being the interesting part, that it's sort of something that's going on between people and their work. It's in that sort of space in between, which I always like the space in between. It's more interesting to me than all that stuff deep with inside. It's just too spooky. No, I like the space in between. You can see it. It sort of rolls out during how people are interacting with each other. And then also, I could also see which choosing what you're going to early in your career choose as a research issue. Well, this isn't going to get solved fast. It's not going to go away. People said, "Oh, burnout, you're still working on that? We solved that years ago." No, we're not going to get there real quick. This is going to hang around for a while. And also, it is not some quirky thing of some subgroup. This is global. This is something that pertains to work and to people all around the world. And I do like traveling. I like seeing the world. And I thought, well, I can talk to people all around the world about burnout, and they will think this is an interesting topic. So all those things sort of went into it. I said, well, this is, and it's complicated. I like complicated problems that you can come at from different angles and try to see different perspectives of how do you make sense of this thing. And that's what I leapt into it. And then I read Christina Maslach's first writing on this, and with Susan Jackson. It was an article in the Journal of Organizational Behavior. And I said, well, this is it. She's got this figured out. So I actually just picked up the phone one day and called her out of the blue, which people did back then, way back in the 1980s. You could just phone people and they actually would answer the phone. It was really weird time. Right. So and I said, "Hi, I'd like to come work with you for a year." And she said, "Oh, sure, come on out." And so I drove from Nova Scotia to California and worked with her for a year and then drove back again. So that's how we sort of got into all this.
Yeah. So what a fascinating story. So you were already in Nova Scotia and doing research on workplaces when you encountered this phenomenon, and then you paired up with Christina, or had you already been doing research that was more in the occupational health world before you saw burnout as an issue?
Not a bit. My background was actually clinical psychology, family therapy, and that was really where my world was. I still haven't. I've never taken a course in work psychology, organizational psychology. I just made it up as I went along.
I love that. Yeah, sometimes you just got to fake it till you make it.
Right, it's that kind of thing. And again, we talk about the civility work that we do. We basically call that doing family therapy with work groups, and that you've got a group of people, they've got stuck in relationships. And the model that they use in conjoint family therapy, where you say, oh, no, the problem's not the kid. The problem really is relationships. Let's try to restructure. Let's practice new ways of talking to each other. That's essentially what we're doing with the civility work, with a work group rather than with a family. And some of these people have been working together in some of these settings longer than their children are living at home. So, I mean, it has that quality to it, you know. And so that was my approach to all this, was coming from that angle, and rather than really from a work psychology perspective.
Yeah, I really appreciate that you're mentioning that, because I will say, for any of the industrial organizational psychology people who might be listening, when I was in grad school, at least, there was still this kind of like old school mentality for some reason that pitted the IO people and the clinical people against each other. Like these were two fields that, for whatever reason, were kind of enemies or butted heads. And in my mind, I've always seen this significant overlap between what clinical psychologists do and what IO psychologists do. If you're a clinical psychologist, which I am not, but I adore them and I go to them for therapy and I work with many of them, you have someone who comes in with a presenting problem. And what you try to do is determine what is the real problem. And you assess the situation and you diagnose and you treat. And I feel like so much of that is what's happening in the IO world too, is that you're going in and you're assessing the organization, and the organization may present to you a problem. I have high turnover, but then your job is to really, through assessment and evaluation, figure out, well, what's the actual problem here? It could be that it's not something related to the individuals in your organization and their lack of ability to cope, but rather maybe it's something about the structure of the workplace that's making these people burn out. So the Venn diagram overlap for me between clinical and IO makes a lot more sense than I think other IO psychologists who may not see where the overlap there is at all.
Yeah, and well, particularly is very close to very close neighbors when you come to family therapy, because that is all relationship. It's all, or couples therapy, that kind of idea of what's going on between people.
Yeah. You had mentioned that you've been researching burnout for a very long time. You've been thinking about this, and people are still today asking you, wait, you're still researching burnout? I mean, why do you think that is? Why do you think that it is something that continues to be investigated from both a research perspective, but also something that just people in workplaces need to pay more attention to?
Well, it's just a very intriguing kind of problem in many ways, but I think part of it is that there's still a lot of unknowns about, well, what exactly do you do about this? Okay, defining it as a problem. I think that, I mean, I'm quite satisfied with the extent to which we understand, well, what's causing burnout and what its implications are, its downstream impacts. We've got a good idea of all of that. But what we have absolutely pathetic idea about is, well, what exactly do you do to address this problem, and how do you change it, and how do you, because as far as I could tell, burnout's becoming a more prevalent issue rather than a less prevalent issue after a few decades of delving into it. So I think that the big question, I mean, really, to me, the only really research question right now is, can you demonstrate that you can do something about it? And to do that, again, you've got to have some good ideas about, well, what are the leverage points and how do you get a hold of them?
I think that's a really interesting point. And I think that, like, obviously you're talking to folks in a lot of different industries. Like, I'm curious, just anecdotally speaking, like, how do you prepare to speak to like a group of healthcare workers, or maybe folks who work in the IT realm, or nonprofits who clearly have like different issues? Like, there are different things that are kind of leading to burnout in those spaces. Like, how do you prepare for conversations with people who are in totally different sectors about a very, like, I mean, all these sectors are experiencing burnout.
Right. Well, I guess I don't get too much. I don't start with the specifics of their area. I really do start with the idea that it's this combination of exhaustion and cynicism and inefficacy, and that is this experience, which really is, there isn't a different kind of burnout in different professions. It is a very human kind of experience at core. So putting my handles on that, and then that there is a level of generality that I can come at, which basically there are things in terms of those mismatches that the Areas of Work-Life Scale covers, that it is a matter of workload. And is it manageable? Is it not manageable with the resources that you have? Is control something that's in balance? You want more control? Are you overwhelmed with control? You don't have enough support. You're entirely in control, and that can be a bit too much for people. Or are you being micromanaged and like losing capacity to really exercise control in a meaningful way? So that kind of that space, particularly between those core motives of like efficacy and autonomy and belonging and your value congruence. Are you, you know, those kinds of things you can talk about at a level, and then it's just a matter of knowing your audience enough to be able to, then get into stories that are more specific to their line of work. But that isn't where I start. I really do start with these conceptual, more general kinds of things. Like as a researcher, that's how I approach that thing. So I'm really interested in what's the common core, and I sort of work out from there.
Yeah, that common humanity that is felt across industries. I think sometimes when people think about burnout, they may say to themselves, well, I have to be burned out because I work in this kind of job. I must be burned out because I'm a nurse. I must be burned out because I work in a nonprofit that services community members with high needs. And we don't really think about like, no, it's not industry specific, right? It could be because as you say about these mismatches between the way that the workplace is designed and the work that you're doing. I mean, there's no denying that some people have jobs that are quite difficult to manage and to cope, and maybe high stress or, high impact jobs such as nursing or first responders. But just because you're an accountant doesn't mean that you can't be burned out at work, right? Like it's not necessarily related to the work. It's the fact that like we are, as humans, we all want some level of like autonomy and control over our lives. We want to be respected. We want to be valued. And so if the workplace is not set up in the way to offer that, then anybody could be burned out.
With that, yeah, and what we find when you do a survey on a large scale, like, in a big institution like a hospital, I mean, you find that they're actually the largest group are the people who are doing okay. They got it worked out. Otherwise, they probably would have left, or someone would find out. The idea, what we did with the profiles, the idea that when you do a latent profile analysis, you find across the three dimensions of burnout that some people just cluster into everything being good. And they're really engaged, and they have the efficacy and the involvement, but then there's other people on the other end who have the exhaustion and cynicism and inefficacy. But then there are other people with just little bits of each of those. But the group that's usually the largest are the people who are on the positive end of those, and the next group are the ones who are just they're not really exhausted. They're not really cynical. They're just not really feeling all that efficacious. It's just like, yeah, it's a job. It's okay. Not stressed out. Like that, those two groups are actually most of the people, even in a place like a hospital, which, as you said, I'm sort of known for having burnout cases. It's the other three profiles, including burnout, are they're relatively small compared to that. Unless you're in a place that's really under major crisis. I've seen a few of those, but only a few. Most places, it's a pretty wide range, and a lot of people have it worked out pretty well.
I do want to ask you about interventions, though, because that is something that you mentioned. That is the thing that we know the least about, is what you can do about it. When Sarah and I have been working with nonprofits in our area the past few years, we've sent out surveys asking folks who work in nonprofits, what are the things that you need the most in handling burnout? And the thing that we've heard time and time again is we need example policies and programs to put in place that can address burnout. So that is the thing that a lot of organizations are craving, is like, what do I do? How do I fix it? And I'm wondering, when you're thinking about those interventions, if that is kind of the next frontier of the research, how do you walk into an organization and convince a CEO or an executive director or a leader to like try this out? Let me try out these interventions and see if they might work. Because a lot of organizational leaders are going to want guarantees. They want to know that if you do this thing, it will work. And even if it maybe not only work for just those folks who are burned out, but is it going to lift all boats? Will that tide take the people who might be ineffective or disengaged? Like, are we going to make everybody a little bit better off with this intervention? And they're looking for those guarantees often, aren't they?
Oh yeah, they are, but they're not going to get guarantees. No,
Okay.
so
Right.
that's too
Okay.
bad.
Too bad.
Not for a long while.
Attention,
We got a lot of work to do
attention
before we can give a
leaders.
guarantee. We could get, we could. I think in those. Wow. I mean, there's a lot of things to unpack there. I think first of all, I guess I don't think of it as going in and sort of doing burnout treatment as I do looking at what do you do to prevent developing or sustaining burnout over time? How do you change how you manage the place? And I think that, and the kinds of things we're working on now, see, as I look at it, there are things that are going on just within a particular work group. It's dynamics of what's going on with leadership or micromanagement or civility or incivility, these kinds of things just within a work group. And then there's the next thing about what's going on between work groups, and how is work being transferred from one place to another. And that's where I think we mentioned in previous conversations that I was very struck watching The Pit and how this issue of transferring patients from the emergency to the ICU is this very fraught kind of moment. And that became a particular puzzle that I wanted to sort of think through. And I had this idea, okay, let's just stay with that for a bit. That particular crunch, that people work it out. And what we mentioned earlier, the favor economy. The nurse from the ICU, from the emergency calls up the ICU and says, I got to transfer a patient. Oh, no, we're all full. You can't transfer a patient. But we have no place for this person to be. They really need to be up in the ICU. And they said, no. But I did a favor. Look, I looked after you last week, et cetera. And you do that's the favor economy. Now, that particular transaction that's a very fraught transaction. That's emotionally charged. And sometimes when nobody has an answer, it can get a little nasty. It can get quite nasty, actually, because you have this idea that when being polite and civil is a very demanding, cognitively and energy demanding thing to do. It's not the easiest thing in the world to do, particularly with people you might not know or might not even like them very much. But still, it's hard. It's not easy. It's not easy. It takes a lot. It's a demanding, energy demanding kind of thing to do, to be diplomatic in that kind of way. So when people are frazzled, that is a really big reach to get to be able to get. So that is the strain that's happening in that kind of situation. And then they don't really, this nurse and this coordinator and these units, they don't have the tools to do anything about it. They can't make a bed appear. They're not the doctor. They can't discharge a patient even out of the ICU. They don't have, that isn't their authority. So they're dealing with a problem they don't have the authority for. It's very tense. They're grading against each other. This is a really unpleasant kind of interaction to have. If anything's going to contribute to their movement on the scale towards burnout that day, that's going to be right there in the center of it. And when you go back and you say, now, this particular juncture for a hospital, is that a big surprise? Oh my gosh, we had this, the emergency is full and the ICU is full. That happens every day. Right. That is not a weird albatross of an idea. That's just how things happen all the time. So why is the place designed that these two individuals have to negotiate with each other? These individuals who don't have the authority or the money or the resources to do anything about it are the ones stuck with that problem. Why is things designed that way? Can you give me, because you could say because, well, it's easy for the people who designed it. They came up and said, well, let's let something magic happen. And then we got the problem solved. So I think that's the kind of thing I'm sort of looking at now and saying, there's a lot of things like that in how organizations are put together. And the process design, just sort of has a gap. And if they were designing your car or something or an airplane that you were flying in, you would not like the fact that we just skipped over that step and figured people would work out how to attach the wings so it wouldn't fall off. You would like that. You'd say, no, they really should have engineered that wing fitting onto the airplane really in detail. But they're not doing that with how do you transfer patients from one full unit to another full unit. What do we do at that juncture? What's the solution? What are the fallbacks? What are the routes to the places that have the resources and the authority to make something happen? They don't do that. It's just there. And I go like, that's the kind of design that's built into the organization from the beginning that is leading to a lot of the aggravation that pushes people. It's not the only kind of thing that does, but that's a big one. That's a powerful, and it's endemic to a lot of organizational crunches.
Yeah, when I'm thinking about this from like the nonprofit sector perspective, I'm thinking about how a lot of the processes that we've created have just become antiquated over time. Like we're not
Mm,
keeping up with technology, we're not keeping up with other things that may be affecting the way that we run our organization. So I think a lot of times
mm,
we fall into, like in the nonprofit sector, we fall into a lot of like unnecessary tasks
mhm,
um that simply because we don't take the time to update an antiquated system because we feel like our role really is to fulfill our external mission to serve the people in the community that we're serving. So taking that time, looking at our processes and getting them updated so that our employees, our staff members have an effective way to work that still kind of fulfills that mission. I feel like that's a pitfall that nonprofits fall into all the time.
yeah, nonprofits do have, yeah, they have their particular ways of doing this. And it is a sector where a lot of people do get burned out and they lose a lot of talent, they lose a lot of people, but even with the people that stay, they lose their edge over time. But it is, so there are some characteristic nonprofit kinds of glitches that way that just how things are managed. Yeah.
Yeah, Sarah and I have talked a lot about how in the nonprofit sector, there's a lot of like, we've always done it this way.
Yeah.
And not a lot of analysis. And sometimes it's because they don't have the luxury to take the time for the analysis, as Sarah just mentioned. But there is a lot of like, we've always done it this way. We don't have time. Yeah. And like, of course you have time.
Uh-huh.
I don't know. I'm going to share this story at the sake of
Mhm.
alienating any of our architectural listeners. But when I was, in grad school many moons ago, we actually worked with healthcare architects. So these are people who design hospitals.
Mhm.
And my little IO psychology self and my cohort folks, we were meeting with these architects. We were looking, Michael, at the time at how electronic medical records were going to change care at the bedside, right?
Make everybody happy.
Right. Yeah. It was going to take all those paper charting was going to go away and it
Mhm.
was going to
Yeah.
change everything. And so part of that research project that I worked on involved getting with architects and asking them questions about these hospitals. They were designing the new
Mhm.
hospitals, and we
Mhm.
didn't need to have a central nurses station anymore because that's where the paper charts lived. Well, what if there are no more paper charts? How are we going to design? So we started asking questions to the architects of like, well, when you design workspaces, like how do focus groups with the nurses? Like, how do you know how to design the spaces? And they looked at us and said, what do you mean? I was like, what do you mean? What do I mean? Like, you're designing workspaces. Are you telling me that you don't actually ever talk to the people who work in those workspaces and ask them how they work and think about that and design that? And I know that, I mean, even when I got my kitchen redone in my house, we redid our kitchen and the cabinet guy
Oof.
comes in and he says, well, you could put the dishwasher here. And I said, why would I put the dishwasher here? This makes no sense for where the
Um,
dishes are going to go. I have to unload the dishwasher every day. And he wasn't thinking about that, right? He was just thinking about like, well,
uh,
the dishwasher is this wide. This is where dishwashers go. And it just kind of strikes me how so many times the people who are designing systems are not actually thinking about the people who are using those systems. And so when you are in an ER department and you need to get somebody to the ICU, is that the time to sit down and, in a big circle and discuss with everybody about how the systems are designed? No, right? Like it's literally emergent. It is an emergency. We've got to get these. So, but the system not being set up to think about the people who are working in it almost
mhm.
guarantees that you're going to have those pinch points that happen, later on.
Yes, it's there, and it does happen, and that's the kind of thing that both, I mean, it drains people's energy, but it also goes to their sense of efficacy because they've got to. These are people who really want to succeed and really make things function, and you're giving them a task that's basically impossible to come out on top of. And they also want to belong to a community that's doing this together, and you're putting in these potentials for aggravation among people that's going to erode that sense of community. So it's a design that is very problematic, to the very core of what keeps people engaged. And then, right, they say, "Oh, we don't have time," and I'm going, "No, you don't have time to do it wrong. You just you can't afford to be doing it wrong. This wrong. It costs you a lot. It costs a lot." Yeah.
Yeah,
Mhm.
absolutely. And I'm thinking about, I'm curious, do you have thoughts about or advice that you would give to like a nonprofit leader who doesn't really have like we have limited resources. We're doing the best that we can on the shoestring budgets that we're operating on. Do you have advice for a nonprofit leader about what they should be focusing on to prevent burnout in their organizations when they don't necessarily have like the financial resources to pay people more money or hire more people into their
Yeah.
organizations?
Well, if you've got a mismatch, you've got more demand than the resources can support. Where you can go from there is pretty limited. And one is to come up with some great efficiency model that is going to be able to stretch those resources further. Unfortunately, where people reached in the first instance for that is why people can work harder. So, or longer or whatever. And I don't recommend that. That is, again, if you want to
Nope.
avoid burnout, you're going the opposite direction at that point. So if there's other ways through artificial intelligence or magic or whatever, where you can be more efficient with those resources, then, that's a way to go. Otherwise, the only other way I see to go is you reduce your mandate. And what I find, I've been universities most of my life, universities hate reducing their mandate. They want to give up a program. It's the most horrible idea they could ever hear of. They want to do all the programs. They want to do everything all the time. If they're taking a new program, they don't want to let go of any old programs. They want to keep having mission expansion all the time because it feels important and feels somewhat threatening to give up any part of your mandate. But basically, for nonprofit leaders who are overstretched in that regard, the options are very few, and reducing your mandate and figuring out how to do that, that's going to keep your funders on side, that's going to prevent despair among your people working for you. You've got to take them along for whatever that direction is, because even though it's not doing them any good, they don't want to reduce their mandate either, but you've got to go there. So the first instance, I say you got to find ways of reducing your mandate. And if you don't do that, you've got a lot of strain. And then within that, I mean, you can't just do it all instantly right away. That would be something that would take time and take a while to get there. The other piece is to figure out where are the crunch points that I was describing, like with the transfer issue. Talk to your people. Where are the crunch points that really make you feel overwhelmed? You're in that kind of situation where you're negotiating rather than doing your profession, particularly that kind of idea you referred to earlier about sort of illegitimate tasks in a way, doing jobs that aren't really your job.
Mm-hmm.
You're not good at it. You don't want to be doing it. And you're not getting any resolution out of that. Where are those things coming into your people's lives? How can you restructure that? Can you get somebody who is good at that, doing that piece of the job? That kind of idea. Where are those crunch points? And how do we build an infrastructure across that? Because the image I'm working with now is that if individuals, through their extra effort, are sort of being a structural element in the organization and how it runs. That idea of that negotiating between these two individuals is how you deal with transfer crises. That's too much load bearing for an individual. or a pair, a couple, their relationship. That's too much stress. That's putting 50 tons on a 2x4. It's the 2x4 is perfectly good piece of wood, but it ain't going to hold up 50 tons. And so
Right.
that's an organizational juncture. It's not a personal relationship. And you got to figure out where are those pieces and how do we build something to handle that load that really is an organizational. So that's what, the stuff I'm working with now. I'll be doing these workshops actually in Australia in August on these kinds of ideas of being able to diagnose those kinds of crunches in the life of the workplace. And then what are the kinds of things you can do to bridge and you know, how much can you do within just your work unit? How much do you really have to go up the line the whole way to the executive suite in order to get the kinds of authority that's needed to patch over? But what can you do at these various levels? Because patching those things becomes very important. And so that's what, back to your nonprofit leaders, they've got to go with their people and find that process, because otherwise they are going to overextend themselves. They are, because they're dedicated. They want to do well. They want to. The need is infinite, and they are not infinite. Like, I mean, just I don't know. In your part of the world, my part of the world, people spend, like, emergency rooms. Back to that one again. There's people spend hours and hours and hours just waiting, and it's so the need is huge. You can't just say go away. But it's a crime. But some little individual isn't the solution to this. You've got to actually come up with an organizational design and a serious answer to what are you going to do with those crunches, not just leave them for your people to sort.
That brings me to a question that I had for you, which is about this toolkit that you're developing. So it sounds like you've got some workshops that are going to happen in August, but then also you're creating this toolkit to help folks deal with burnout. What do you think is the main unresolved issue around burnout that you are trying to solve with this toolkit? Is it around those pressure points? Do you think, is it about implementation of policies? Like, what do you hope that this new toolkit that you're developing is going to specifically address?
Yeah, I'd say it is on those various levels. It's looking at, I think, like I would say that the kinds of things that press towards burnout are like on these various, some things are within your unit, some things are intersecting, some things are like the whole mission of the organization is, they were talking about, just sort of out of whack. And some things, again, are just even on a political, regional, economic level of, what really can be supported. And your part of Kentucky or my part of Canada, in terms of the level of healthcare for the general population, what really are, and can we expand that? Can we make that more effective in a way? So I'm sort of looking at all these different levels and going, well, okay, what can you do as an individual? What can your work group do? Here are the kinds of problems that you may be identifying, and what are some of the options that are happening there? And then these more larger scale collaborative things, like you're going to get the emergency and the ITCU working together on solving this transfer problem, because it's in both of their, how do you make sure both parties know it's in both of their benefit to get this thing straightened out? And how can they work together on that level? And then how do you model that, okay, our new system is working, it's got some rigidity to it. Usually what you're doing is putting in some rigidity that when there is a transfer glitch, we've got a whole protocol that we go through that goes step by step until we get the thing resolved or into the right hands for somebody who, higher up, that is going to resolve this kind of thing. What are those steps? How do you go through that process? That's the kind of, so I'm looking at it very much that the drivers of this are organizational design, glitches, flaws, management, glitches in various ways, and how to resolve those kinds. That's the piece I want to work on. I mean, there's other things you could do to help people prevent or recover from burnout, but this is the piece I'm looking at, is organizational design, how to engineer the process of the work that you're doing so it's more effective in that way.
The thing that I thought was really interesting about the toolkit is that it comes from like a frontline worker's perspective. So oftentimes when we're talking about burnout, when Courtney and I are having conversations, it's like these are things that leaders should be doing in their organizations to combat burnout. But the toolkit, as it reads and it kind of as you get towards the end of it, really talks about how you can log the problems that you're having, and then how you take that unemotional information and you relay it to like your C-suite or the person that's like above you in the hierarchy of your organization. So I just thought that that was really interesting. Was there a reason why you decided to kind of go that route? Like, let's look at the frontline workers and tell them essentially how to communicate to their bosses to make change?
Well, with a lot of talks that I do, the frontline workers are generally a bigger part of the audience than the managers are. And that they're well,
Does
the managers are having their own issues in terms of burnout as well. I mean, it's not like
Sure.
they're free of all of this, but I think if they could be working together with their frontline people. But no, I think, and people always go, well, what can I do about that? And usually they think, oh, well, I'll do some relaxation training or some mindfulness. And I say, well, those are good things to do, but it isn't going to address your problem, because that is the lack of mindfulness. I don't think is causing your problem. I think the cause of your problem is poor work design, and that really will be the piece to work on. So, but I think, and that's what earlier saying we don't have the tools to really address burnout, and I think part of it, one need I see is articulating what can people do on a workplace level, on an individual or a management group or a work group level, that can make a difference on these things. What can you put into place? And it needs to be something that you put into place, and it just like, again, I like the idea of protocols. Here is the system that we've constructed here based on our personal experience, which has got some real depth because they've been doing this work and they know what it feels like when they hit that crunch. And so that becomes a powerful thing to work with. And I think, that's just sort of direction I want to really explore for a while now.
I have kind of a more philosophical question for you. I'm just curious because you've been doing this work for so long. How has the way that you think about burnout changed over the years?
Oh, well, I guess it really is that idea of, being more relationship, being more embedded into the structure of the organization, and as really the whole experience as existing more between people than within people. That's been a particular piece. And then the other piece I think that's been important to me is that when we talk about the profiles, the idea that there's a burnout profile and an engaged profile, but also there's a lot of people who talk about being burned out are just overextended. They're just exhausted. They love their work. They're very engaged with it. They think it's just, but they're not getting enough sleep. They're not getting enough rest. They're not getting enough support in doing their job. But they're not burned out at all yet. And that's a really different kind of problem. I think a much more manageable problem than being burned out is to be overexhausted, just simply exhausted. It's a real problem, but it's more manageable. That there are people who are just disengaged, and they're not exhausted because they can't be bothered to be exhausted.
Right.
And they think they're wonderful. They don't have any problems with that because they think they're wonderful. They just think this place is run by a bunch of idiots and they're not going to wear themselves out for it. So they're out there in the world too, and that's different from that's not burned out. They need a very different kind of approach if you want, and they might not think they have a problem, but anyway, they have a very different kind of approach that's needed there. And then there are people who are just lacking efficacy, but they're not exhausted and they're not really cynical. But they're not really, feeling like they're doing so. So those are that particular framework. Rather, before you just look, well, there's burnout and then there's not burned out, and then it was burnout and then there's people who are engaged, who are actively, and that's maybe something to work towards. And now this idea of these, other kinds of neighboring states to burnout. It makes it a more it's a more continuous kind of world in that way.
Yeah, I so appreciate thinking about not just the squeaky wheel, and not just the top performer, but kind of everybody else that is in your
Yeah.
organization, like not forgetting
Yeah.
about them, and whether they're disengaged or ineffective or overextended, like whatever it is, they may need different interventions and resources to get them closer towards that engaged profile, higher job satisfaction, more committed to the organization, staying with the organization longer. Like if you want those things from those employees, you may have to be more intentional about the different kinds of interventions that and programs that you offer them.
Yeah, you do, because again, there is not one size that fits all. You really do have to look at these things. And to me, in doing big level surveys of places, I mean, you want the data, you want, my MBI scores, I want all the quantitative data, but I really value what people write, and always having it there and giving them some engaging kinds of prompts to go, tell me about, like, what are two things that really work in your job, that really make your job worthwhile, or things like that. Get the positive end as well as, and see what people write about it, and then cluster those comments along with what profile they're in. What are the engaged people talking about that's really different from what the people who are overextended are talking about? And then those words are going to give you a lot more direction on what kind of programs they're going to be seeing as valuable.
And such a great question to ask, because I bet a lot of employees are not asked that in any systematic way. So if it's part of the Maslach Burnout Inventory, and they get to finally, like, hey, somebody wants to hear what I have to say about this job. I mean, sometimes you can get some really great responses from people if they're not getting an opportunity to offer that in another place.
And I thought, questions like that just opened into things like, if you could change one thing about this job, what would you change? And it will give you it, because people aren't all that good at giving you a formal diagnosis, but they can tell you, I want to change this. And then it's for you to deduce, well, what's that telling you about how things are running in their lives or not running in their lives? So, yeah.
Yeah, I think so. What I want nonprofit leaders to hear is keeping honest, open communication with your people, creating relationships with your employees in a way where you can understand or identify when something's off, but also giving them an opportunity to give their honest feedback about what their job looks like, because every day you're all the ones that are out there doing it. So I really, really love that. Typically when we're wrapping up our conversations, we like to ask our guests, what is one message that you would share with someone who might be going through burnout, or what would you want a nonprofit employee listening to this to take away from the conversation from your perspective?
Oh, I'd say really pay attention to, I'd say track how you're feeling at work over time. If the burnout is part of what's going on with you, I would track your days just as you're going to work. And what are the high points? What are you doing? Who are you talking with? What are your activities? And what are the low points during the day? Trying to get a map of what's working and what's not working for you. Because, I mean, maybe you'll get to the point where you're going to leave this job, but you're going to need another job, and you need to understand what's working and not working before you can choose to be at a better place, the better place for where you are now and where you want to be going with your career. So I'd say really do take your time to try to figure out what's working, what's not working, and how you can how you can shape a future so that you get more of the stuff that's working and less of that stuff that's not working.
That is really great advice, like that kind of pattern recognition. It's almost like the little clinical psychologist in you just told people to journal. So
journal, yeah, basically, yeah. You gotta figure out yourself and your relationships, and what is it? Who are you with? What are you doing? What are the
identify your
activities?
patterns and
yes, yeah, your behavior settings and all that. Yeah,
yeah. That's really great advice. I love that. Well, Dr. Michael Leiter, what an absolute pleasure it has been to talk to you. This has been a wonderful conversation. I am really like energized by the way that you talk about burnout and how excited you are to continue to research this is so refreshing. And it was just such a wonderful pleasure talking to you today. So thank you for being on the podcast with us.
Well, thank you for a very engaging conversation. Really enjoyed this.
Hey, Courtney.
Hey, Sarah.
We just talked to Michael Leiter on the podcast.
I know. I know.
Look at us.
I don't even know what I'm a little like, don't know what to say because I'm so like, wow. Some people say never meet your heroes. You should totally meet your heroes because they
Totally
could
meet your
be
heroes.
wonderful, fantastic people with great advice and still so much passion for the thing that made them a hero. Yeah, I'm like buzzing with excitement about the conversation we just had.
Yes, absolutely. I think we got a lot of good information from Michael. I mean, who else do you go to but the godfather of the Burnout Challenge, which happens to be next to me. Look at us. Look how we're cute. Yeah, I just think that he had so many amazing things to say. I really like that he talked about the pit, right? He like, hey, attention everyone. We know you're watching the pit. There's workplace information in all of these shows, and you will see more of that in an upcoming episode of the Burnout Room. Where we talk
I know.
about the burnout profiles.
But I really, Sarah, I don't want to watch the pit. Like I don't want to watch it. My health anxiety cannot handle these medical shows. Can somebody please make edits of the pit where you edit out all of the gross body stuff and any mention of disease and all the gory, just take all that out and just keep in all of the workplace stuff. I promise it'll still be just as dramatic for me and then I can watch it. But he is not the first person who has mentioned that show as really showing some of these pinch points that he talked about that are showcasing structures in workplaces that are not efficient, effective, and actually cause people to, in a high pressure, high stress moment, to actually be uncivil to each other because they are trying to solve a really urgent problem that they can't solve because of the structure that caused it.
Yeah. And so when we were talking about the toolkit, that Michael developed for frontline workers navigating through burnout situations in their environments, there is a quote in that I wrote down that I'm going to read out loud. So it says, "You aren't burned out because you lack character. You're burning out because you're being used as a load-bearing beam in an unfinished building." I mean, yeah, you're burning out because you are trying to stay afloat in a place that is continually like not supporting your weight. Which as a nonprofit person, like just makes so much sense in the world. Like we talked a little bit about unnecessary tasks. So like tasks that don't really need to exist, but they do exist because you have to work around systems that don't work.
I want to just say one point about that really quickly, which is that I do think for nonprofits specifically, we're constantly adding to people's plate because we have to.
Yep.
But there is an opportunity there to say, but what can I take off of somebody's plate?
Yes.
What can I take away? Could be a way to reduce workload specifically for nonprofit folks. So just wanted to like put that in.
And I think that a lot of nonprofit folks that hear you and Michael say, hey, maybe you should consider taking a look at those programs that you're working on, are going,
I know.
No.
Yeah. Cringe.
For those of you who can't see, who aren't watching live, I'm cringing right now really hard. The thought of getting rid of programs is going to feel uncomfortable. But if you want to succeed and your folks are burning out and you're seeing turnover like crazy, like something's got to change. And if you can't pay folks more, if you can't bring more people in, you got to look and see kind of if you're overextending folks.
Yeah. And maybe look for collaboration with other organizations, other nonprofits, see our episode about community engagement, maybe
Smart.
getting intentional about doing some work with universities, with students through internships or community engaged courses. Like, I think that there are creative ways that nonprofits can try to reduce some of that workload burden from their folks. And that could also go for-profit organizations as well.
Yeah. And I think one thing that I want to reiterate that came up in our conversation with Michael is like, make sure that you're like keeping track of things that are causing you friction. Like if you want to, like if you're a staff person like me and you want to go to your boss and be like, my job is stressing me out, have some data behind why. Like I'm starting to feel like I'm moving into a burnout place. This is why. Let me show you the things that I have logged, like going in a more emotional space, just kind of ranting about nothing feeling good. Like that's not going to move the needle as much as write those notes down, write down the things that are like really bugging you that maybe aren't as efficient or processes that are causing you issues. Write that stuff down. Make sure your boss knows what's up. And bosses,
Yes.
leaders, be receptive to hearing that information.
Listen to that. Yes.
Yeah.
That's something that your people are telling you that needs to be fixed. Yeah, I definitely noted that. I think I'm going to start doing that. I don't feel burned out in my job, but I was thinking, I was like, oh yeah, when I do this task or when I have to do this thing, I never tell my boss or anyone who is in charge of that process in the moment how much heartache and time and energy it takes for me to do that. I need to start writing that down and then giving that to my supervisors, leaders, whomever, so that the process can be changed. Because they may not know that it's that broken.
Yeah. And I think that a lot of nonprofit folks can probably relate to having MacGyvered processes. Like, I cannot tell you how many processes that I have worked through over the years that are essentially bubble gummed and rubber banded together. Like, those are things that we can work on. So just like in my burnout story, right? I talked about financial management and how terrible that was for me and how I didn't know how to do that job. And then I now know how to do that job because they hired somebody. Like I had rubber banded and bubble gum together processes for finances that were not doing me any favors because I didn't know how to do the job. My boss listened when I said that, and he found a consultant who came in and taught me how to do that portion of my job. So leaders listen, staff people document, and I think we can make the successful changes.
Yeah, change the process.
Change the process.
Yeah.
Okay, Courtney. Well, this was just like the biggest blast of all time.
Yep, absolutely. Stellar conversation with Michael. He was a joy. And I really look forward to seeing what he does next and where his next research project takes him. Okay, Sarah, it is our favorite part of every episode, which is our ripples of gratitude, where we are intentionally grateful to someone, something, with the hope that that inspires our listeners to also show their own gratitude, thereby rippling throughout our community. And today I wanted to give my ripple out to the healthcare workers that I encountered at my recent eye doctor appointment. So this is an example, speaking of Michael Leiter and about systems, where the system was broken. It did not work the way that it was supposed to. And so I couldn't do what you were supposed to do, which is check in electronically. So you go to the doctor now, you got to check in at the kiosk, which I did. But it didn't work. And I couldn't figure out why it didn't work. And then I have like new vision insurance. And so I have to go to the person. And this is the IT curse that follows me everywhere I go.
Yes.
So, okay. I go to the front desk and I'm realizing it takes a minute. She's like, I cannot find you. I cannot find your vision insurance. And I was like, but I am literally standing in front of you with my vision insurance card in my hand. So I know. And then I start questioning, like, do I know my social security number? Is that actually mine? You know, because I have many social security numbers memorized, as most
parents
wives and mothers do.
Yes.
And then all of a sudden it hit me when I was looking at the card. I was like, oh, this doesn't have my full name. It only has the letter A, which is the first initial of my first name, which I don't go by. Do you see like the complicated nature here?
Yes.
And I was about to say something to the person. I said, hey, I know this is weird, but like, you're probably going to have to look me up in a different way. And she looked at me and she was like, I have already found you in the system. You are already checked in. And I was like, oh, and I said, it's because when I started at my job, like they put me in, like if I go into my computer system at work, my first name is just the letter A.
Oh, excellent.
so I was like, they probably, when they were filling out the health insurance stuff, okay, whatever. So on top of all of that, not only did she like already solve the problem, figure out the workaround from the system that was broken and get me checked in, I then offered to pay my copay. And she said, girl, you've got a credit. You don't owe me any money. I was like, this is the best eye doctor visit I've ever had. So she was incredibly helpful and I appreciated it so much. And then even when I was leaving, the contact lens lady, I won't say the place because I don't want to get any of these people in trouble. But she was like, I'm going to give you 2 different kinds of contact lenses to try out because I'm not sure. Like she was looking at what the doctor had given me. And I think she kind of saw that like, maybe this could work or maybe that could work. Maybe she's authorized to do that. But it just, in both of those instances, I had 2 people that were kind of looking at the way the system is supposed to be set up and did something slightly differently that had me have a very pleasurable experience and got my eyes all checked out. I got some trial contact lenses to like, it all just worked. And both of those could have gone a completely different way. So I just really appreciate people who are working in those jobs where things don't go as planned. The system is not set up as it should be. And yet you're still able to provide really good service to the people that you are helping. So kudos and gratitude goes out to my healthcare workers at my eye doctor's office.
First off, of course, the IT curse followed you because it follows you everywhere.
Everywhere.
I really appreciate that they gave you some like personalized care. I think that that's really fantastic. When you were saying like they went above and beyond because the systems were not set up in a way that or were not working in the way that they were supposed to. That ties in pretty well to my ripple of gratitude today, which goes out to the internet service provider technician who came out to my tiny house in the woods and gave me real internet last week. So we've anecdotally mentioned before, I live in a rural area. During the pandemic, we were working solely off of mobile hotspots on our cell phones. Like, I have not had real internet at my house since we moved there 15 years ago. So this is a big deal. They finally brought out like real people internet to the woods. So we got everything set up. They came out on a day where it had been like essentially flooding in the morning. Like we had flash floods in the morning. Wasn't even sure if people were going to get out to our house. Luckily the waters receded and they were able to come out. What they weren't expecting was that we live like farther back on our property. So there's a pole in the front of the property, but there's also one that's back by our house. They had run the internet line to the first pole at the front of the property, but they sure did not run the line from that pole to the pole next to our house. So this poor man had to run lines through trees by himself at our house, which was certainly not something he was expecting. But he climbed the poles, he got the lines run, he got everything set up in our house, and now we have the fastest internet that I could possibly have imagined out in the woods. And I can run Zoom calls while my kids play Fortnite. So it's a dream. And so just big kudos to that man who was not expecting that he was going to have to actually run line to our house in the middle of the woods last week to bring us good internet.
Yeah, thank goodness to that wonderful man that now you have, high-speed internet to your house. I know how much we take that kind of infrastructure for granted until you don't have it. And I've been on calls with you before where I'm like, just turn off your video. It's fine. We could just make this a phone call. It can really affect the way that you do your job sometimes or your kids' ability to be able to get connected to their friends even. So, he could have maybe thrown a little bit of a fit and said, I'm not doing that. But it sounds like he went around that bad structure that existed and was able to get you the internet that you needed. So thank you to that man. I appreciate it.
Yes, thank you, man. Okay, well, this amazing episode of the Burnout Room is sponsored by the Kentucky Psychological Foundation. If you'd like to help support our work bringing free mental health resources to Kentucky nonprofits, please consider donating at kentuckypsychologicalfoundation.org.
Yes, and huge thanks to our producer, Sophia Schindler, for all of her amazing work, and to my dad, Mike Russell, for composing our music.
And to all of our listeners, thank you for tuning in and being a part of this community. Don't forget to rate, review, and subscribe so you never miss an episode. And feel free to leave a comment about topics that would be most helpful for you and your organization.
We look forward to reading your comments, and we'll see you next time.